listeners, like our patients. So will one person in the group, that's why I've mentioned this, like to share one thing they've learned today? Can you hear the crickets? Oh. He won a prize, he's going to talk.
I really like the soft skills being software.
Yeah, and that there are running operating program. Students, take note of that. An experienced therapist says they're not soft skills, they're hard-earned skills. And something else to think about, the word compassion doesn't come up enough. We talk about empathy, which is feeling another, but compassion is wanting to do something. I think we're all feeling compassionate. I'm the only person who's going to mention it about Ukraine. We feel helpless because we can't do anything. We're empathetic individuals feeling helpless. That's the difference. That's why we feel, empathetic clinicians and patients and people feel Ukraine's pain. Being compassionate is going to do something. So in England, if you look online, they're actually setting up some volunteer programs for UK and PT students. So it's something you might like to consider. I'm promoting the Ukraine project, but it's on Twitter. So they're looking for people to volunteer to help out students from Ukraine doing the PT programs. So think about that too. Anybody else like to share something? Hold on. Sarita, fire away. You wanted to share something. You've got two, I'm afraid. You are bisexual and have two weenuses. He's going to go home in the pub. I got a weenus. And by God, when you bang your elbow, it hurts your weenus, doesn't it? So think about this. Insensitive to this is why I mentioned this. It's actually an important point. I work with a doctor called Dr. Stephen Kozlich, who operated on patients via progressive anaesthetic, spinal patients, no anaesthesia unless they said, ow. Very rarely did we inject any, not me, them, I use we as the royal we. Very rarely did patients ask for an injection, slice through the skin, down, cutting bone off, through the lamina. Only time they asked for pain was when you touched an inflamed nerve root or a disc that had herniated. And I said to him, yeah, but that doesn't prove anything. And he loved me. Yeah, it does. I've written a study about it. Yeah, but it's like my weenus. I mean, what? It's you're written up, so you might look at Stephen Kozlich's study, it's quite different. When you do a pain provocation study and you burn somebody with a cautery iron and say it doesn't hurt, I'm not sure my disc was ever set up for burning. There's no danger signal of burning, like there's no danger signal. Why do you think this is incentive to mechanical pain? Yeah, because this is students' elbow position, isn't it? We'd be in agony as students on courses if this was painful. Most of us sit for hours at school doing this, don't we? And you even get bursitis and it swells up and you think, I'm still going to go like this because this is like the crappiest thing I've ever done. So, anybody else want to share one thing they learned today? Your name is?
Megan.
Good memory, Megan. This is the other trick I have about I can't remember people. I wrote down 3 people's names, that's it. Megan, always remember she's called Megan, what would you like to share?
So I really wanted to thank Sarita for really helping me remember the importance that disability can be an identity.
Absolutely. So, bisexual, black, disabled, indigenous, female, she, her. That's what I heard. But she's other things too. The stuff I don't know about her as a person. What does she enjoy? What does she do for a living? Where has she been to college? I know she went to college recently and graduated, etc. So even though we know that about her, there is so much more we need to discover about the people that we call patients. What does the word patient mean?
Take your time. Take your time.
Correct. But what does patient, as in the people we thought we saw, mean? Because I know we've had this discussion on Twitter. I think Joeletta will confirm this. The word suffer, I suffer. People don't want to be said they're suffering. That's what the word patient means in Greek, to suffer. So it may be a word that we use not as common as you currently are. Now, I think we have some comments for those poor people at home who have no idea what the hell has been going on in the room. So I'll shut up because we're 5 minutes and 28 seconds over time, but I don't give a rat's patootie. Do I look like I care? Do I look like I'm bothered?
That's why they get a girl like me to be like the bouncer. Like, alrighty, sir, step down. No. All right, so...
I've got to tell the story. I've only met Sarah once. I am famous, so beware of this. If I know where you live, I generally just turn up unannounced. So last year, exactly about this week, I went into the... both of you. Went to the clinic and they went, yeah, we're closed. I said, it's me. Both just looked at me like, yeah, who's me? So I was in Chicago and I just popped in.
I don't think we said we're closed, but I wasn't expecting someone, so I'm like, shoot, I screwed up the schedule, didn't I?
Actually, I look like this now.
But it's always a fun surprise. But we don't want to take up all the time because we have a couple more great speakers, and then also After Dark, and then also I just saw something about s'mores. So, yeah, later. So just to wrap up, though, Keith Meldrum, who is he's not here today physically, he's here online. He did want to share. As one that lives with persistent pain, and after speaking with many others that do as well, we ask that health providers treat the person and not the disease. And I thought that was just a great wrap up to this whole discussion of, you can say patient-centered, but really what are we trying to say and accomplish?
Person focused. Thank you very much. I end on that.
Thank you.
By the way, feel free to color me.